In Ethiopia, the African Union Commission is screening for the coronavirus as it hosts the bloc's events in the capital, Addis Ababa. The Commission, which hosts the Africa Centre for Disease Control, has been working closely with member states since the coronavirus outbreak was declared. CGTN's Coletta Wanjohi reports.
Guests accessing the African Union Conference Centre are being checked as they come in for the African Union Summit events. Medical experts are on site just in case of emergency. The African Centers for Disease Control says it is not taking any chances.
This particular outbreak doesn't respect borders. As we've seen in China, it's a fast-moving virus. It's evolving very quickly. So the issue of border doesn't even count here, because an outbreak in Kenya will quickly become an outbreak in Tanzania and Ethiopia, so and vice versa. So I think that issue we are coordinating with our regional collaborating centers and member states in each region, so that there's a common understanding of what this virus is about, especially with respect to the rate at which it's spreading there.
At the main entry point into Addis Ababa for most of the AU delegates, the Bole International Airport in the city, more screening points have been set up since 22nd January.
We have selected isolation centers. Now we are actively working in one isolation center, and we had another 4 isolation centers in case if there is an increasing demand for isolation.
Suspected cases in the continent have tested negative. For now, African countries are depending on South Africa for lab diagnosis. The Africa CDC says it is working to equip at least 15 more African countries with diagnosis kits. And the talk of a vaccine for coronavirus has begun in the continent too.
The beauty is that this virus was detected just last month. We already know the sequence, and that is allowing us to develop a diagnostic test, and that will also allow us to begin to develop vaccines and treatment there. So, but again, just to be sure that we know what we are dealing with here, a vaccine would not be available in the next 3 months or 6 months, because it requires a series of practical steps to test it and make sure that it's safe and that is effective in humans.
The Africa CDC is urging delegates at the AU summit to be on alert and report any suspicious symptoms. Coletta, Wanjohi, CGTN, Addis Ababa, Ethiopia.